Okay. This is the confidence we have in approaching God, that if we ask anything according to His will, He hears us. Okay, so we're going to continue with gram-negative bacteria. So, I just wanted to say, I am studying when I'm reading this and explaining certain things. So if there's there will be gaps, because I'll be looking things up, reading from my first aid. So it might be like 4 or 5 minutes gaps in between. So if you're just revising or trying to run through this fast, please listen to it at 1.75 speed or 1.5 to 1.75 speed. Listen to it. If we're trying to take notes, you can always slow it down under one, and it's in the settings, so in the YouTube settings, so you can do that. All right, let's get started. So gram negative is pink in color. It's split into diplococci, coccobacilli, and curved rods. Diplococci are aerobic. Diplococci is just two balls next to each other, and that's what they look like. And it is uses oxygen, which is why it's aerobic, and it's split into a bacteria that uses maltose acid that is detected by maltose acid, and one that is not. So Neisseria gonorrhea and Moraxella does not detect maltose acid, and Neisseria meningitis does detect maltose acid, and the coccobacilli here is Haemophilus influenza, Bordetella pertussis, Pasteurella, Brucella, Francisella tularensis, Actinobacter baumannii, and now we're going to go on to the bacilli, gram-negative bacilli. So it's split into bacteria that ferments lactose and bacteria that does not ferment lactose. We're going to go with the side that does ferment lactose first. The bacilli that ferments lactose is E. coli, Klebsiella, Enterobacter, and Serobacter and Serratia. So those five, they ferment lactose. Now, the bacilli that does not ferment lactose would be, it would be Pseudomonas, and Salmonella, and Proteus, and Shigella, and Yersinia. Now, the bacilli, the non-lactose fermenting bacilli is split into oxidase, negative and positive, and it is also split into bacteria that produces hydrogen sulfide, and bacteria that does not produce hydrogen sulfide on TSA agar. So, lactose fermentation. Bacilli that does not produce lactose. Bacteria that does not produce lactose fermentation and is oxidase positive would be Pseudomonas, and bacilli that does not ferment lactose and is oxidase negative would be Shigella, Yersinia, Salmonella, and Proteus. Bacilli that does not ferment lactose, that is oxidase negative, and does not produce hydrogen sulfide on TSA agar would be Shigella and Yersinia. Bacilli that does not produce lactose, that does not ferment lactose, gram-negative bacilli that does not ferment lactose and is oxidase negative and produces hydrogen sulfide on TSA agar would be Salmonella and Proteus. So we're going to quickly just run through this. Okay. So I can go ahead and say for Neisseria, Neisseria does not detect maltose acid. Neisseria meningitis it does detect maltose acid, and for Shigella and Yersinia, they do not ferment lactose, is oxidase negative, and does not produce hydrogen sulfide on TSA agar. For Salmonella and Proteus, neither of these ferments lactose, and and they are oxidase negative and produces hydrogen sulfide on TSI agar. Pseudomonas does not ferment lactose and is oxidase positive. E. coli, Klebsiella, Enterobacter, Citrobacter, and Serratia, they all ferment lactose. Now up here, curved rods. So these are the gram-negative curved rods. They are all oxidase negative. Oxidase positive. Camelobacter jejuni grows in 42 degrees Celsius. 42 degrees Celsius, which is 107.6 degrees Fahrenheit for measure, and so they grow in pretty hot temperatures. And oxidase positive, Vibrio cholera grows in alkaline media. H. pylori, it produces urease, and these are all oxidase positive. Next, we're going to go on to Neisseria. Neisseria is a gram-negative diplococci, and that's just two balls put together. That's what they look like. Metabolizes, so Neisseria metabolizes glucose and produces IgA protease. Neisseria contains lipo-oligosaccharides, which with strong endotoxin activity. Neisseria gonorrhea is often intracellular, so it's within neutrophils. All right. So here, Neisseria breaks down glucose to produce energy, and Neisseria also has IgA protease in them. So IgA protease is made by Neisseria and cleaves IgA at the hinge region. So IgA cannot work, so Neisseria can cling onto the mucosal surfaces. Okay, so IgA that's in the Neisseria comes and destroys the the immunoglobulin A that's normally in our body. It breaks it down so that IgA can no longer protect us. So this allows Neisseria to attach to our mucosal surfaces. Okay, so remember it's IgA protease. Okay, now Neisseria gonorrhea is often intracellular within the neutrophils. The lipo-oligosaccharides bleb off and cause an inflammatory response, leading to leakage of capillaries and consumption of platelets, which leads to the petechial rash. Okay, all right. So Neisseria cannot grow on blood agar because they are inhibited by stuff on blood agar, but can grow on heated blood agar. So Neisseria is oxidase positive. It grows on VPN agar or Thayer-Martin agar. Remember that? All right. So on the side it says acid production, meningococci, then it says maltose and glucose, then gonococci glucose. So what this means is that maltose is only this means maltose can only be used by meningococci, and glucose can be used by both meningococci and gonococci. All right. So remember, meningococci maltose starts with M, and meningococci uses maltose and glucose, but gonococci only uses glucose. Okay. Now for gonococci, it is a facultative intracellular, and it's found in PMNs. So PMNs. polymorphonuclear neutrophils. So gonococci is found in the PMNs, which are polymorphonuclear neutrophils. Um, these have no polysaccharide capsule. There is no maltose acid detection, as we just said. There is no vaccine due to antigenic variation of the pilus proteins. What this means is Neisseria has pilus that makes Neisseria attached to the mucosal surfaces, and pilus also does um, okay. So there's no vaccine due to antigenic variation of pilus proteins. Okay. So Neisseria has pilus that makes Neisseria attached to the mucosal surfaces, and pilus also does genetic rearrangement. Okay. So basically, there's no vaccine because due to the antigenic variation of the pilus. Um, what is antigenic variation? It means that it keeps changing, right? Antigenic variation. I believe it. Yeah. Antigenic variation. Okay, so it just means that a structural variants emerge that alter recognition by established immune response that allow those pathogens to persist. So basically, yeah, the structure keeps changing. The structure of the pilus, so the structure of the Neisseria keeps changing. So then the body's immune system, like macrophages, T cells, can identify this, can identify its Neisseria. It looks um, it looks different, so the antibodies won't work for this new pilus. Okay, all right. I think when the pilus does genetic rearrangement, I think that's what I wrote down. So Neisseria has pilus that makes Neisseria attached to the mucosal surfaces, and pilus also does genetic rearrangement, so the immune system cannot identify them. Just make a note of that. Does genetic rearrangement. So, body's immune system. Body's immune system cannot recognize. Cannot recognize Neisseria. Okay. Next, it is transferred sexually or perinatally transmitted. Perinatally transmitted. What is that? Perinatally transmitted. A transmission of disease-causing agent from mother to baby during the perinatal period, the period immediately before and after birth. Okay, so when the baby is still inside, you can get it. Okay, or parentally transmitted, causes gonorrhea, septic arthritis is usually in one knee, neonatal conjunctivitis 2 to 5 days after birth, pelvic inflammatory disease, and Fitzhugh-Curtis syndrome. What is that? Fitzhugh-Curtis syndrome. PAD can spread to peritoneum. Infection of the peritoneum can lead to adhesions that form uh, to the capsule of the liver. So that's when the pelvic inflammatory disease spreads to peritoneum. Infection of the peritoneum can lead to adhesions that form to the capsule of the liver. It is a white purulent discharge seen in gonorrhea, and thin discharge, and thin discharge seen in chlamydia. Okay, Fitzhugh-Curtis syndrome. Fitzhugh-Curtis syndrome. Okay. Fitzhugh-Curtis syndrome is a complication of pelvic inflammatory disease incurred due to both chlamydia and gonorrhea, violence during appearance of chronic adhesions, fibrosis. So it's a bunch of adhesions from pelvic inflammatory disease, and pelvic inflammatory disease is from Neisseria. This is what it looks like. These adhesions. Infection may extend by direct or lymphatic spread beyond the pelvis to involve the hepatic capsule or the diaphragm, associated with gonococcal and chlamydial cell meningitis. Yep, that's what that looks like. All right, let's see. Okay. All right. Now, this is so the mother is infected. If the mother is infected with Neisseria, the baby can get it while the baby is still in utero. So after the baby is born, the kid can get neonatal conjunctivitis 2 to 5 days after birth. 2 to 5 days after birth, gonorrhea is passed from the mother to the baby, and the baby gets conjunctivitis 5 days after birth. So remember that neonatal conjunctivitis is what it looks like. Neonatal conjunctivitis. Neonatal conjunctivitis. Okay. So gonococcal, chlamydia, and conjunctivitis. So this is what it looks like. Here it is. Okay. It's from Neisseria gonococci. Okay. Now, condoms decrease sexual transmission. Erythromycin eye ointment prevents neonatal blindness. So for that, what we just saw, give erythromycin. Treatment for Neisseria gonococci is ceftriaxone plus azithromycin or doxycycline for possible chlamydial co-infection. So the treatment for gonorrhea is ceftriaxone. Give azithromycin and doxycycline for co-chlamydial infection. Okay. Treatment for gonorrhea is ceftriaxone, and you give azithromycin and doxycycline for co-chlamydial infection. Okay. So, okay, azithromycin or or doxycycline. Okay, so for treatment for gonorrhea, you give ceftriaxone and you give azithromycin or doxycycline for co-chlamydial infection. Neisseria, gonorrhea doesn't stain because infection is intracellular. This foot over here, that is that is from meningococcal disease, showing gangrene of the toes. We're getting into meningococci now. Meningococci does have a polysaccharide capsule, which protects the meningococcus against phagocytosis. Here, meningococcus uses maltose acid detection. Neisseria ferments both maltose and glucose. Remember, meningococci up here. Meningococci uses maltose and glucose. Okay, so it can detect meningococci can detect maltose. Vaccine type B, vaccine type B vaccine available for at-risk individuals. And type B is not readily available in vaccines, so people get type B strain infection in the West. So type B is not readily available in vaccines, so people get type B strain infection in the West. All right. So here in the West, we get type B strain. We're more prone to it. Meningococci is transmitted by respiratory and oral secretions. Meningococci causes meningococcemia with petechial hemorrhages and gangrene of the toes, as you can see in this foot picture right here. Okay, and also meningococci also causes meningitis, Waterhouse Fredrickson syndrome, which is um, a combination of adrenal insufficiency, fever, and DIC. So what it is it's a hemorrhage of the adrenal glands due to hypovolemia. Hypovolemia is caused by leakage of the capillaries from the lipo lipo lipolipoglycosaccharides lipoglycosaccharides blebbing off and lipoligosaccharides causes endotoxin to go into the blood, and this causes shock. Okay, so that is how you get shock in BAC. It is when the adrenals hemorrhage. Okay. Meningococci can lead to DIC. This is meningococci is diagnosed by culture-based tests or PCR. You treat with rifampin, ciprofloxacin, or ceftriaxone. Prophylaxis in close contacts. Treatment is with ceftriaxone because ceftriaxone can cross the blood-brain barrier, or penicillin G. Now, other thing to remember about Neisseria is that C5 to C9 deficiency increases the risk for Neisseria because patients with C5 to C9 deficiency are unable to form MAC complexes, leading to Neisseria infections. So if somebody has a C5 to C9 deficiency, if somebody has a C5 to C9 deficiency, they are at risk for Neisseria because patients with C5 to C9 deficiency are unable to form MAC complexes leading to Neisseria infections. Alright, we're done with Neisseria. Remember this, okay? It's super high yield. And also remember, like, it causes arthritis. Remember, if they talk about, like, um, a girl with achy joints and she has unprotected sex and doesn't use condoms regularly, um, and she has like pustules. Let's see, yeah, she has like pustules and achy joints. Think Neisseria. All right, think Neisseria, gonorrhea, gonococci. Okay. All right. Mm. So I'm gonna go through my World Journal also, where I covered a bunch of questions, and it's also notes from first aid, going through like high yield points. So I believe I wrote some question like that. We'll go through that in another video. All right, next. All right. Haemophilus influenza, also extremely high yield. This is a small gram-negative coccobacillar rod, aerosol transmission, non-typable, is uncapsulated strain. It is and are the most common cause of mucosal infections, otitis media, conjunctivitis, bronchitis, as well as invasive infections since the vaccine for capsular type B was introduced, as well as invasive infections, since the vaccine for capsular type B was introduced. Okay, produces IgA protease. So this hemophilus influenza also produces IgA protease. Which other one we just covered produces IgA protease is Neisseria. So this is how the hemophilus gets into our body by destroying our own body's IgA, immunoglobulin A, so it can stick to our surfaces, mucosal surfaces. Now, hemophilus influenza is cultured on chocolate agar, which contains factors 5 and 10 for growth. So factor 5 is NAD plus, and factor 10 is hemantin for growth. It can also be grown with Staphylococcus aureus, which provides factor 5 by RBC hemolysis. Hemophilus causes epiglottitis. So right here you can see that epiglottitis endoscopic appearance in A can be cherry red in children. Okay, so the epiglottis can be super red in kids. See this right here? It looks like a thumb sign on the lateral neck x-ray. Maybe you can't see it the best over here. I'll just show you epiglottitis. Epiglottitis x-ray. So you see this thumb sign here, narrowing of the airways. Okay. It looks like a thumb, yeah. Right there, thumb sign. Okay. So here, the kid will be like leaning forward, and epiglottitis. Where's this? Yeah, the kid will be leaning forward, and kid will show signs of respiratory distress because of the inflamed epiglottis, and the patient will have all this. Yeah, this one, tripod position. Patient. Oh my goodness. Patient will be in tripod position. Kid will have retractions, extended neck and chin, cyanotic lips, high fever, muffled voice, drooling due to dysphagia, and inspiratory stridor. Okay, next. All right. And Haemophilus influenza. Um, okay, so Haemophilus influenza causes meningitis, otitis media, and pneumonia. Um, it is the non-typable one is the most common cause of mucosal infections like otitis media, conjunctivitis, bronchitis. Okay, now, okay, the vaccine contains type B capsular polysaccharide. Um, the polysaccharide is made up of polyribosyl ribitol phosphate. So the vaccine contains type B capsular polysaccharide conjugated to diphtheria toxoid or other protein. Remember, we said that a vaccine is attached to a toxin for better T cell response. So that's why the type B vaccine, the HIB type B vaccine, is added to the diphtheria toxin to get a better T cell response. This vaccine is given between 2 and 18 months of age, does not cause the flu. Influenza virus does. The Haemophilus influenza does not cause flu. It causes meningitis, otitis media, pneumonia. Okay, so don't mistake it with the flu. Treatment is amoxicillin with or without clavulanate for mucosal infections, ceftriaxone for meningitis, rifampin prophylaxis for close contact. Alright, I'm just going to make a note of this. Does not cause flu. Okay, so treat Haemophilus influenza with amoxicillin with or without clavulanate for um, otitis media and pneumonia. And then if the patient gets meningitis from Haemophilus influenza, give them ceftriaxone. And if somebody's in close contact with somebody that has Haemophilus influenza, give them rifampin. Same thing with Neisseria, give them rifampin as prophylaxis. If they have if somebody has a meningococcal disease and other people were in that person's vicinity, you give the close contact rifampin. Okay. Next, glottitis. This is glottitis. Glottitis. Okay, now this one down here. Okay, so Actinobacter baumannii is a gram-negative, strictly aerobic, oxidase-negative coccobacillus. Okay. It is a commensal opportunist, but increasingly associated with resistant hospital-acquired infections, especially in the ICU, can cause ventilator-associated pneumonia and septicemia in immunocompromised patients. This is we talked about this right here. Let's see, this one right here, under Coccobacilli, Actinobacter baumannii. So this one causes pneumonia. It's seen in the hospitals, in ICU patients. Okay. So ventilator-associated pneumonia and septicemia in immunocompromised patients. Bordetella pertussis. So this is pertussis. Okay. It's a gram-negative aerobic coccobacillus. The virulence factors include pertussis toxin, which disables GI. Okay, which disables GI. Okay, so virulence factors include pertussis toxin, adenylate cyclase toxin, and tracheal cytotoxin. 3 clinical stages. So it has 3 stages. The first one is Catterall stage, which is low-grade fevers and coryza. Okay, coryza. Coryza pertussis. Okay. Oh my gosh. Okay, coryza. What is runny nose, sneezing, low-grade fever, mild, occasional cough similar to the common cold. Alright, so it's runny nose. Okay. So that's the first stage, low-grade fevers, coryza. The second stage of Bordetella pertussis is paroxysmal, where you see paroxysms of intense cough followed by inspiratory whooping cough and post-tussive vomiting. Post-tussive vomiting, like after you cough, vomiting. Post-tussive vomiting. Violent coughing, paroxysms are often followed by emesis. Okay, so after you cough, you throw up. It's seen with pertussis. So that is the second stage. So you have stages of intense cough followed by inspiratory whooping cough and pertussive vomiting. So you cough and then you vomit. Okay, the third stage is convalescent stage. It's a gradual recovery of the chronic cough. This Bordetella pertussis is prevented by Tdap, DTaP vaccines. May be mistaken as viral infection due to the lymphocytic infiltrate resulting from immune response. May be mistaken as viral infection due to lymphocytic infiltrate resulting from immune response. Treatment is macrolides. If allergic, use TMP-SMX. Okay, so what you need to know, The virulence factors include pertussis toxin, adenylate, adenylate toxin, and tracheal cytotoxin. Okay, so pertussis toxin disables GI. Pertussis toxin inactivates GI subunit, which increases adenylate cyclase, which increases CAMP, which causes whooping cough. Okay, so that's what this means. You see how pertussis toxin disables GI. So pertussis toxin inactivates GI subunit, which is a protein, and this will increase adenylate cyclase. This will increase adenylate cyclase, which will increase CAMP, which causes whooping cough. Okay? Alright. So remember, Bordetella pertussis increases CAMP. Okay? And this causes the whooping cough. The first stage is runny nose. The second stage is intense cough. It's like, and then intense cough, and then when the patient breathes in, you hear a gasp like sound on inspiration, like yeah, they sound like they're gasping for air when they're breathing in, and then after they cough, they have very bad vomiting. Now that is the second stage, known as paroxysmal stage. Convalescent stage is recovery stage from the chronic cough. Bordetella pertussis is prevented by Tdap and Dtap vaccines. May be mistaken as viral infection due to lymphocytic infiltrate resulting from immune response. So that means B and T cell count means high lymphocyte count. Okay, so it can be mistaken for viral due to high B and T cell count. Okay. Treatment is the macrolides, and if allergic, use TMP SMX. The macrolides are what? Azithromycin, erythromycin, clarithromycin. Okay. And now we're on to brucella. Brucella, it's a gram-negative, aerobic, coccobacillus. Treatment is transmitted by ingestion of contaminated animal product, like unpasteurized milk. Survives in macrophages in the reticuloendothelial system. Can form non-caseating granulomas. Typically presents with undulant fever, night sweats, and arthralgia. Treatment is doxycycline, rifampin, or streptomycin. Brucella, gram-negative, aerobic coccobacillus, transmitted by ingestion of contaminated animal products, like unpasteurized milk. Survives in the macrophages in the reticuloendothelial system. What is the reticuloendothelial system? Reticuloendothelial system. Okay. So this is where brucella survives, reticuloendothelial system. Okay. Reticuloendothelial system. Okay. Reticuloendothelial system is liver, spleen, lung. Okay, that's where the brucella survives. Okay. It can form non-caseating granulomas. Typically presents with undulant fever. Undulant fever. Undulin fever is an infectious disease due to the bacteria Brucella that causes rising and falling fevers and sweats. Okay, so it's rising and falling fever. Okay, so let's see, rising and falling fever. Rising and falling fever. And Brucella also causes night sweats and arthralgia. Treatment is doxycycline and rifampin or streptomycin. Okay. Um, Brucella. So treatment is doxycycline plus rifampin or doxycycline um, plus streptomycin. Okay. You should really not write it like that. So it should be doxycycline, doxycycline plus rifampin, 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 or doxycycline, or doxycycline plus streptomycin, okay, streptomycin, okay. This one you get from animal products, okay, contaminated animal products. Legionella pneumophilia. Next, it's a gram-negative rod. Gram stains poorly. Uses silver stain. Grows on charcoal yeast extract, medium with iron and cysteine. All that stuff is super important. Okay, detected by presence. Detected by presence of antigen in the urine. Labs will show hyponatremia. Okay. Aerosol transmission from environmental water source habitat like air conditioning systems, hot water tanks. No person-to-person transmission. Treatment is macrolide or quinolone. Think of a French legionnaire soldier with his silver helmet sitting around a campfire that has charcoal with his iron dagger, but he's no cysteine. Interesting. Legionnaire's disease, severe pneumonia. Okay, often unilateral and lobar. Okay, it's on one side. The pneumonia is on one side. It's in the um, lowest lobe. It's on the lowest lobe. Yeah, lowest lobe. Um, the patient has fever, GI, and CNS symptoms. Okay, has fever, GI, and CNS symptoms. Common in smokers and in chronic lung disease. Legionella is what causes Pontic fever, which is mild flu-like syndrome. Okay, and then yeah, Legionella is a gram-negative rod. Gram stains poorly. Uses silver stain. Grows on charcoal yeast extract, medium with iron and cysteine. Detected by presence of antigen in the urine. Labs may show hyponatremia. Aerosol transmission from environmental water source. So it comes from water. From environmental water source habitat like a AC hot water tank. Okay. This Legionnaire's disease, severe pneumonia, often unilateral and lobar. So I'm going to write lobar pneumonia right here. Lobar pneumonia, pneumonia. Mm, you can get fever, GI, and CNS symptoms common in smokers and in chronic lung disease. Lesion. So it multiplies in the building water system. Water containing Legionella can spread in droplets for that people breathe in. So basically, I just remember somebody telling me like, oh, after you come back from like a long trip or something, you let the water run, and um, if it's contaminated, you can breathe in Legionella and get pneumonia like that. And people don't know because they don't understand that it's from the water. I mean, who thinks you're gonna walk into an apartment after like a vacation and then let the shower run and then you can get pneumonia from that? But the Legionella multiplies in water systems, okay, and building water systems. All right. Pontic fever, mild flu-like syndrome. Now we're gonna go on. Okay, so treatment is macrolide or quinolones. Yeah, macrolide or quinolones. What are the macrolides? Azithromycin, erythromycin, clarithromycin. Or you give quinolone. Okay. So Pseudomonas aeruginosa. Okay. Okay. Next. Okay. Pseudomonas aeruginosa. Aeruginosa is aerobic, so it needs oxygen. It is motile because it has flagella. It is catalase positive. So that means Pseudomonas will break down hydrogen peroxide. Um, it is a gram-negative rod. It does not ferment lactose. Remember we said there's lactose fermenters and there's non-lactose fermenters. Pseudomonas is a non-lactose fermenter. So Pseudomonas is a non-lactose fermenter right here. Bacilli, gram-negative bacilli, non-lactose fermenter, Pseudomonas. Okay. All right. Next, we're gonna go on to Pseudomonas. Yeah. All right. Non-lactose fermenter. It is oxidase positive. Frequently found in the water. Has a grape-like odor. Pseudomonas will turn um, purple on oxidase test. Okay, that's just an extra point. Pseudomonas is associated with pneumonia, sepsis, ecthyma gangrenosum, which is necrosis, UTIs, diabetes, osteomyelitis, mucoid polysaccharide capsule, otitis externa, which is swimmer's ear, nosocomial infections like catheters, equipment, addicts like drug abusers, skin infections, hot tub, folliculitis, wound infection, burn victim. The mucoid polysaccharide capsule may contribute to chronic pneumonia in cystic fibrosis patients due to biofilm formation. So remember this: in cystic fibrosis patients are very prone to pseudomonas infections. The mucoid polysaccharide capsule may contribute to the chronic pneumonia and cystic fibrosis patients due to the biofilm formation. Okay, produces PEEP. So Pseudomonas produces PEEP. It's a phospholipase C, which degrades the cell membranes. Phospholipase C in the Pseudomonas degrades the cell membranes in the humans, and also endotoxin causes fever, shock. Exotoxin A inactivates EF2. Pigments pyoveridin and pyocyanin. This will show up as blue-green pigment, as seen in this diagram right here, right there. Um, also generates reactive oxygen species. which means Pseudomonas creates hydrogen peroxide, which is bad for. Okay, so Pseudomonas creates, it brings hydrogen peroxide with it because it has catalase, positive. So it creates hydrogen peroxide, which is bad for human cells. Yeah. So what it means, Pseudomonas will break down the hydrogen peroxide before the WBC, before the human WBCs can get to hydrogen peroxide and use it to kill off Pseudomonas. Pseudomonas creates hydrogen peroxide, which is bad for human cells because Pseudomonas uh, Pseudomonas will break will break hydrogen peroxide into water and oxygen, water and oxygen, so that the human WBCs cannot use cannot use the hydrogen peroxide. Can I use the hydrogen peroxide to kill Pseudomonas? You see how smart these bacteria are? Pseudomonas. Okay. All right. So that's that. Now, so let's see. Pseudomonas is associated with pneumonia, sepsis, ecthyma, gangrenosum, UTI, diabetes, osteomyelitis, mucoid polysaccharide capsule, otitis externa. Otitis externa is pain and hearing loss. Okay, and Pseudomonas is seen in addicts, drug abusers, drug abusers, skin infections, hot tub folliculitis, wound infection, burn patients. And it's also seen in cystic fibrosis patients due to the biofilm production. The capsule, the polysaccharide capsule in cystic fibrosis. I mean, the polysaccharide capsule in Pseudomonas helps it stay in the lungs of cystic fibrosis patients. Because of this capsule, there is a biofilm production which helps Pseudomonas grow in the lungs of cystic fibrosis patients. Okay. Okay. So Pseudomonas does not have lactase, so Pseudomonas will not turn McConkey agar pink. Okay. Um, so Pseudomonas produce phospholipase C. It produces endotoxin and exotoxin and the pigment pyridine and phenocyanin. So Pseudomonas produce endotoxin and exotoxin. Which one is more potent? It's exotoxin. Exotoxin is worse than endotoxin. Okay. Now, the other thing is corneal ulcers, keratitis, keratitis in contact lens wearers, um, minor eye trauma, ecthyma gangrenosum is rapidly progressive necrotic cutaneous lesion caused by Pseudomonas bacteremia, typically seen in immunocompromised patients. It's right here. This is it. It's necrosis. Um, Treatments include campfire drugs, which is carbapenems, aminoglycosides, monobactams, polymyxins, um, fluoroquinolones, third and fourth generation cephalosporins, extended spectrum penicillins like piperacillin, ticaracillin. Okay, so carbapenems include meropenem, imipenem. Aminoglycosides include amikacin, gentamicin, streptomycin. Mono, Monobactams include astrionam. Polymyxins include polymyxin B, colistin, and then fluoroquinolones include ciprofloxacin and levofloxacin. Third and fourth generation cephalosporins include ceftazidime, cefepime. Extended spectrum penicillins include piperacillin, ticaracillin. All these can be used for Pseudomonas campfire. Okay. So that covers this. So corneal ulcers, keratitis, contact lens wearers. You can get Pseudomonas infection. Keratitis. Okay, so this is an eye infection. Pseudomonas can cause this. Wear glasses. Okay. Alright. Next. Oops. Okay. Next we have Salmonella and Shigella. They are gram-negative rods. Both Salmonella and Shigella are gram-negative rods. They do not ferment lactose. They are oxidase negative and can invade the GI tract by M cells of Peyer's patches. Okay, so they're non-lactose fermenters. Neither Salmonella nor Shigella will turn pink on McConkey. Agar is oxidase negative, will not be purple. So that means it will not, neither Shigella or Salmonella, neither of them will be purple on oxidase test. When you do the oxidase test, bacteria will turn purple from the color it was normally. So neither Shigella or Salmonella will turn purple. Okay. Alright. So Salmonella grows black colonies. Salmonella is capsulated and motile. So Salmonella typhi. Type A, okay, so typhi, VI. So this one, it's a type of capsule. This VI, it's a type of capsule. Salmonella typhi is only found in humans. It can disseminate by blood. Once in the body, Salmonella typhi spreads by blood. Hydrogen sulfide gas. Yes, Salmonella typhi produces hydrogen sulfide gas, like we said up there. Remember we said produces H2S on TSA agar. Here, so Shigella, Salmonella. Okay, so Salmonella does produce hydrogen sulfide on TSA agar, while Shigella does not, and that's going to be seen down here. Oh, great. Okay, so hydrogen sulfide. Salmonella does produce hydrogen sulfide. Now, flagella. Salmonella does have flagella. Remember, salmon can swim. Virulence factors in salmonella produces endotoxin. Okay. Um, and VI capsule, it has a VI capsule. Infectious dose is high. You have a large inoculum required. Acid label, which means it's inactivated by gastric acid. So basically, infectious dose, you need a high amount of salmonella to infect 50% of the population. And infectious dose, how much dose is required to infect 50% of the population? So for salmonella, you need a high dose to infect 50% of the population. Okay, so remember, this is endotoxin. It is not as fatal as exotoxin. Okay. Um, Effective antibiotics on fecal excretion, it prolongs the duration. Effective antibiotics on fecal excretion. So antibiotics for salmonella make you poop longer. Effects of antibiotics on fecal excretion. Yeah. So if you get antibiotics for salmonella, it makes you poop longer. Immune response. It's monocytes. GI manifestations. Constipation is followed by diarrhea. The vaccine. Oral vaccine contains live attenuated salmonella typhi, and the vaccine is oral drops or a pill. IM vaccine contains a VI capsule polysaccharide. Unique properties, causes typhoid fever, and you can see the rose spots on the abdomen, constipation, abdominal pain, fever. Later, GI ulceration and hemorrhage. Treat with ceftriaxone or fluoroquinolones. Carrier state with gallbladder colonization. So somebody who is a carrier of typhoid, salmonella typhi, goes and hides in the gallbladder of the carriers. Now everyone that has typhoid gets typhoid. So somebody that can cook for you, you can get typhoid from that. That person might have it in their gallbladder, but you will unfortunately get it if you're eating their food. So, yeah. So salmonella species, except for salmonella typhi. So this is the non-typhi right here, the non-typhoid stuff. So this one infects humans and animals. It can disseminate by blood. It does produce hydrogen sulfide on TSA agar. They can also, it swims. It has the flagella. It is an endotoxin. Infectious dose, you need a high amount of the salmonella to affect 50% of the people. The antibiotics make you poop longer. PMNs are I always forget this. PMNs, polymorphonuclear. PMN is. PMN. So this is polymorphonuclear. Polymorphonuclear. It just means neutrophils. So in typhoid, it is the monocytes that react. In salmonella species, it is the polymorphonuclear neutrophils that react. Diarrhea, you can get diarrhea, possibly bloody. There is no vaccine. No vaccine for any salmonella species except salmonella typhi, because typhi is the one that will kill you. So Salmonella, you can get this from poultry, eggs, pets. Turtles are common sources. Surprisingly, turtles. Okay. I mean, turtles can be kind of evil. One almost bit my finger off when I was playing with it in the aquarium. So, what thing is a snapping turtle? So remember, it can carry salmonella. Think of snapping turtle and salmonella. So this, antibiotics are not indicated. Gastroenteritis is usually caused by non-typhoidal salmonella. The worst thing you can get from salmonella is probably gastritis. Gastroenteritis. Gastroenteritis, yeah. Alright. Um, Next, Shigella. Shigella grows green colonies on Hex. What? One sec. Shigella. Okay, so Shigella grows on some type of agar, hexotoin. I had that written. I don't know if that's important, but I tried to look it up. I couldn't find it. So, okay. So Shigella is carried in humans, cell to cell. Shigella jumps from cell to cell. That's how it's spread. There is no hematogenous spread. Um, Shigella does not produce hydrogen sulfide. It does not have flagella. Shigella produces endotoxin known as shigatoxin, which is an enterotoxin. An enterotoxin is any toxin that works on the GIT, that is called an enterotoxin. Remember, all gram negatives have endotoxin. The infectious dose for Shigella is very low. Only a very small inoculum is required to infect 50% of the people of the population. It is acid stable, so your stomach acids are not. It's not going to destroy Shigella. Shigella is lethal, more potent, so only small doses are required for 50% of the population to be infected. If you get antibiotics, it stops the diarrhea, so it stops the patient from pooping. immune response. It's in the polymorphonuclear um, immune response. The polymorphonuclear neutrophils will respond. The polymorphonuclear neutrophils will respond um, in Shigella infection. Polymorphonuclear neutrophils will respond. Okay, so the GI manifestations is crampy abdominal pain, tenesmus, bloody mucoid stools, bacillary dysentery. So tenesmus is because of tummy pain, crampy abdominal pain. The patient feels severe urge to poop. That's what tenesmus is, the urge to poop. Bloody mucoid stools, so yeah, bloody mucousy stool. Bacillary dysentery is it's a rod that gives you dysentery. So it's Shigella will give you bloody poop and very bad tummy pain. Okay, and there's no vaccine for Shigella. Shigella is transmitted by not washing hands. Remember the 4 F's of Shigella: fingers, flies, food, and feces. So in order of decreasing severity, less toxin produced. Decreasing severity. That is Shigella dysentery, then Shigella flexneri, then Shigella boydii, then Shigella sonnei. So out of these, the most toxic is Shigella dysentery. The least toxic is Shigella sonnei. And Shigella does invasion of the M cells. It's key to the pathogenicity. Invasion of M cells is how you get the disease. Invasion of M cells of the Peyer's patches. Okay, so Peyer's patches, remember this? Right here in this corner right here. So what is Peyer's patches? Peyer, M cells, oh Peyer, M cells of Peyer's patch. So right here, this is the mucosal membrane of your intestines. So see this. M cells are on the top. Antigen comes and gets into the M cells, and that is how you get Shigella. See, microvilli, M cells, the lumen, epithelial layer. Okay. Okay. So Shiga toxin binds to the 60S subunit of ribosomes. Shigella is a use of Shigella does the use of actin filaments to propel itself to invade enterocytes and lymphoid tissue. It damages tissue and releases cytokines. This causes fecal blood and leukocytes in the poop. That's why you get bloody diarrhea in Shigella. Okay, now we're going to go into Yersinia enterocolitica. It is a gram-negative pleomorphic rod slash coxobacillus is usually transmitted from the pet poop, like puppies, and contaminated milk or pork can cause acute bloody diarrhea, pseudoappendicitis, right lower abdominal pain due to the mesenteric adenitis and or terminal ileitis, reactive arthritis in adults. So you can get this from puppy poop or contaminated milk or pork. Yersinia transmitted by puppy poop, contaminated milk. Bipolar staining looks like a safety pin. Okay, so this looks like a safety pin, okay? Same as bipolar staining. It can cause bloody diarrhea and right lower abdominal pain due to mesenteric adenitis or terminal ileitis, so that's inflammation of the ileum. And what is mesenteric adenitis is a syndrome. Mesenteric adenitis is a syndrome characterized by right lower quadrant pain, secondary to inflammatory condition of mesenteric lymph nodes. Right lower quadrant pain, secondary to inflammation of lymph nodes. So mesenteric adenitis is right lower quadrant pain due to inflammation of mesenteric lymph nodes. Okay, mesenteric lymph nodes. Key site for mesenteric lymph nodes. So mesenteric lymph nodes are just lymph nodes around your intestines. Okay, so Yersinia can cause bloody diarrhea and right lower quadrant pain due to lymph nodes being inflamed, like the intestinal lymph nodes being inflamed, and it can cause reactive arthritis in adults. Okay, lactose fermenting enteric bacteria. Lactose fermenting enteric bacteria is fermentation of lactose. If you have fermentation of lactose, it produces pink colonies on McConkey agar. Examples include E. coli, Enterobacter, Klebsiella. E. coli produces beta-galactosidase, which breaks down lactose into glucose and galactose. So E. coli ferments lactose, and then E. coli also produces beta-galactosidase, which breaks down the lactose into glucose and galactose. EMB agar, lactose fermenters grows purple or black colonies. E. coli grows colonies with a green sheen. So a McConkey agar E. coli will show up as pink colonies, but on EMB agar, E. coli will show up as purple or black colonies, and then on and E. coli grows colonies with a green sheen also. Okay, because EMB agar, lactose fermenters, well, E. coli is a lactose fermenter, so it will be purple or black colonies or green. Okay, or an EMB agar, and then a McConkey agar, E. coli will be pink. Okay. So remember, the Salmonella typhi is the #1 cause of osteomyelitis in patients with sickle cell disease. Oh no. Okay. Yeah. Salmonella typhi is the number one cause of It is the number one cause of osteomyelitis in patients with sickle cell disease. Salmonella enteritis has a type 3 secretion system, which is a protein that not only detects eukaryotic cells, but when it does, it secretes a protein that helps with infectivity. Okay, Salmonella enteritis has a type 3 secretion system, which is a protein that not only detects eukaryotic cells, but when it does, it secretes a protein that helps with infectivity. Okay, Salmonella typhi and enteritis are both facultative intracellular, but within the macrophages. Okay. So Salmonella typhi is intracellular. So it lives inside the macrophages. So Shigella type 3 secretion system to secrete inflammatory cytokines. Okay. So the main thing is Salmonella typhi is the number one cause of osteomyelitis in patients with sickle cell disease. Salmonella enteritis has a type 3 secretion system, which is a protein that not only detects eukaryotic cells, but when it does, it secretes a protein that helps with infectivity. And then Salmonella typhi and enteritis are both facultative intracellular, but within the macrophages. Okay. All right, it's an hour and a half. This we shall do tomorrow. Should we do it? Okay, let's see. Yeah, we will do this tomorrow, and good night.